Now, the enactment of amendments to the National Hospital Insurance Fund by the National Assembly have been hailed as reformist at a time when the cost of healthcare remains a heavy burden for Kenyans. The regulations propose to expand access to the fund for Kenyans as young as 18 and is expected to boost the struggling insurers' coffers. But a number of Kenyans say the fund cannot bail them out, even with the reforms. Bridget Ngana has their story.
Eunice Njambi walks to her hardware shop for another day of work. But over and above fending for her family, she's saving up for medicine and a treatment trip to India. Njambi has a non-malignant brain tumor affecting an eye and ear, which requires regular medical attention.
Nilikuwa nimeshazoea pia kuumwa na kichwa. 2019 something happened, November. Nikaanza kusikia makelele kwa masikio and my headaches were very severe. So I started clinics at PGH. Nikaanza kuambiwa shida ni nini, goiter it's pushing a nerve, of which I didn't know which nerve it was. So I had to be done emergency surgery. Every month I use almost 5,000 because I have to have the painkillers. There's some medicine of which this last neurosurgeon gave me for the brain. That one lazima nikunywe kila siku.
And so began a long, stressful treatment journey for Njambi. A member of the NHIF medical cover, she sought treatment and drugs at various facilities, but would soon realize that not every treatment is covered by the national insurer, so she had to pay out of pocket. Worse still, she has been advised to travel to India for further treatment, where again she is left to her own devices.
That's what I came to realize higher. So there are some surgeries that can be helped with the NHIF. The delicate ones can be helped with NHIF. Okay, it was so frustrating, but the money that we were told it's needed, it's 1.8, of which is inclusive of the flights and the treatment.
Such is the burden of many a Kenyan, bogged down by emerging illnesses, but often having to pay out of pocket for treatment. Now, a bill proposing a raft of reforms to the National Hospital Insurance Fund is headed to the Senate after being approved by the National Assembly. It proposes that every Kenyan upon turning 21 years of age to register for NHIF and contribute 500 shillings a month. Parliament also approved the categorization of self-contributors to the fund. The most contentious remains a proposal that employers pay an equivalent amount as their employees or top up the deficit.
End of last quarter, we were just talking about slightly over 30% that were active. So this means that people contribute, then use a service. After they've gotten their health benefits, they default. This becomes very difficult to be able to sustain.
A recent report by the Auditor General says the National Health Insurer is broke with a funding gap of 3.6 billion shillings.
By making it mandatory, then everybody has access to that basic care, will be able to do that. And then that leaves out then those people who cannot afford at all. So the key thing is to be able to identify them and support.
Back at Njambi's shop, the wait for affordable Medicare continues, an aspiration anchored in the Big Four agenda, but which remains elusive.
There's no that money, but I've told friends to help me out. I will be a miracle that God has done.
You can see how Njambi swiftly moves through the string and crochet as she crafts the beanies, these rasta-colored beanies like the ones I'm wearing. And this is Njambi's lifeline because by selling these beanies, she's able to get her medication that she needs on a daily basis. Njambi represents a huge percentage of the Kenyan population whom, despite them paying for their NHIF cards, they are still locked out of treatment due to the severity of their medical conditions. Bridget Ngana, NTV, Nakuru.